Hi, my name is Olivia Van Leeuwen and I'm a grade 11 student at Lawrence Park. Right now, I am in UHN's co-op program at Toronto General Hospital in the electrophysiology department. My passions include the sciences and helping others. UHN is the University Health Network and it owns many hospitals and other medical buildings including Toronto General, Toronto Western, Princess Margaret, Toronto Rehab, and the Missionary Institute. Co-op is an experience-based program where students are able to enter a workforce they are interested in and learn what this industry is truly like to gain knowledge and understand the path they want to take. To me, co-op is a way for me to gain real-life experience in the field I am interested in through the endless opportunities it has to offer, as well as make connections and learn from the professionals. Electrophysiology is the study and treatment of the heart's electrical activity. The clinic deals with problems relating to this and the resulting tests such as pacemakers, Holter monitors, and stress tests. There are a few different occupations found at my placement. These are nurses, doctors, device technicians, receptionists, and inventory workers, plus more. My role at my placement is to be a general helper. My tasks include working on administrative tasks, unboxing equipment, filing, faxing, and making calls. Often as well, I get to observe cardiology appointments and procedures including Holter monitor hookup, electrocardiograms, echocardiograms, pacemaker checkups, TAVI surgeries, ablations, and pacemaker implantations. I have learned so much at my co-op placement, including much more about cardiology procedures and more about the heart/circulatory system itself. As well, I have learned about how to make professional phone calls, send faxes, scan documents, and more. I've been developing my leadership experience at my placement by getting to know staff and using initiative to ask to observe different procedures. My placement supports diversity, equity, and inclusion by always being respectful, understanding, and kind to all staff and peers alike. When I arrived at my placement, I could tell that everyone treated their peers with such compassion and empathy, as well as responsibility to help out when someone needs it. As well, UHN prioritizes accessibility and works to remove all barriers for patients and staff. Another important thing to mention is that they have an anti-harassment phone number that you can call if you're ever uncomfortable, which encourages people to speak up. An interesting fact about the EP clinic is that it's connected in a loop to the echo lab, where they do different kinds of echocardiograms. This way, if a patient needs an echo and a Holter, they only have to walk across the hall. Aside from the heart, what I've learned overall from my co-op placement is that patience and kindness gets you far in life. Everyone who I've met has shown me both of these two principles, as well as been eager to teach me more, which I am very grateful for. I plan on maintaining these connections I have made after my placement is over, as well as bringing all the knowledge I have gained of this industry with me through university and beyond. What workplace diversity and inclusion means to me is providing everyone with what they individually need to succeed and always being kind without judgment. Finally, some advice I would give to anyone debating taking co-op next year would be to do it. This is an experience that I could not have imagined, and we're very privileged to have an opportunity like this. I'm so grateful to have this experience, and I know it will take the values and knowledge I learned with me beyond just this semester.
Hello, my name is Jessica Howard, and I am placed at the Toronto Western Hospital Emergency Department at UHN. I am in grade 11, and I have a passion for helping people, and am dedicated to a future in the healthcare field. High School Co-op is a program in which students are able to gain real-life experience in various industries and spend every day at placement. Co-op has given me the opportunity to explore the healthcare industry and has given me a chance to see if this is the career path I want to pursue. I am placed with UHN, which is the University Health Network. This is a chain of hospitals across Toronto, including Toronto Western Hospital, Toronto General Hospital, Princess Margaret Cancer Centre, and more. UHN is a part of the healthcare industry, and there are tons of different occupations at my placement, such as nurses, doctors, ward clerks, surgeons, and more. In my co-op position, I spend every day shadowing nurses or other people working in the emergency department. I not only get to learn lots by observing what they do, but I also get to complete tasks to help them, such as retrieving and handing items to a nurse, sending blood work, and sometimes even taking vitals. To me, workplace diversity and inclusion means understanding and respecting everyone's background, experiences, and perspective. My co-op placement supports diversity, equity, and inclusion in both the treatment of patients and staff. In the emergency department, everyone is treated the same, no matter their race, religion, or even age. There is no exclusion or judging. There are also resources for people who need them. Social services are very helpful in this area. Lastly, the Toronto Western Hospital Emergency Department has an Indigenous patient navigator to provide support to Indigenous individuals and allow them to practice their traditions. Did you know that the emergency department is split up into various sections? These sections are registration, triage, acute, subacute, ambulatory, and EMS holding. Registration is where patients are first checked in. Triage is where patients talk about what is wrong and get their vitals taken. The triage nurses then place them in one of 3 sections based off of the severity of their injuries. Acute is the most severe section. In this section, many of the patients are unstable and all stroke patients are placed here. The resuscitation room is also located here. Subacute is a step down. These are still severe, but they're not as bad as patients in acute. This is mostly filled with people with chest pain and older people. Ambulatory is where the least severe patients go. This is where small issues, broken bones, and cuts are placed. Lastly, EMS hold is where patients sit after coming in an ambulance. They are monitored while other spots open up. Some of the benefits I have received from participating in the co-op program are gaining hands-on experience in the healthcare industry. I've known for a while that this is the career path I want to take, but co-op has given me the chance to experience it and be sure this is what I want to do. I've also already learned so much about healthcare and different conditions and procedures used, such as an ECG, blood work, and more. I have also developed my leadership and workplace skills by taking initiative throughout my day. I've learned to go get things even before I'm asked so that I can further improve efficiency. Lastly, talking with new people in the emergency department every day has drastically improved my communication skills. I meet so many new people and have small conversations with many of them. By participating in co-op this year, I've learned lots about myself and what I want to do in the future. I've also learned so much about healthcare. I've learned lots about ECGs and how they work. I've learned lots about blood work, and I've learned lots about broken arms and casting. I've even learned about other medical procedures such as a cardioversion. I'm planning to use my experiences here in the future when I hopefully work in the healthcare industry. Because of this placement, I already have a feel for the teamwork used in healthcare and how a lot of systems, like Epic, the computer system, work. I will put this on my resume so people can see that I already have had hands-on experience in the healthcare industry. Co-op is a great opportunity to explore that industry you're interested in. It is also a great learning experience and will teach you lots. It is totally worth the extra time, and I've been having a great time at my placement. Take co-op!